we know that since COVID, there's an increase in cancer, there's an increase in autoimmune disease, increase in dementia and Alzheimer's. There's increase in a number of other illnesses that a lot of people believe are potentially from the COVID virus. So a lot of people don't realize that sometimes you can get persistent symptoms after you get a virus, basically symptoms that don't go away. Symptoms persisted for longer than a month or two. That can now be diagnosable as long COVID or post-acute sequelae to SARS-CoV-2. And the symptoms are pretty disparate. You can have over 250 different symptoms. The research actually shows that 5 mild symptoms give you a greater chance of getting long COVID than, kind of like what you had, which were really intense symptoms.
So I am super excited to chat with Dr. Evan Hirsch. We're going to be talking about long COVID, tying it into chronic fatigue.
Those people who end up getting it is that they have what I call are the toxic 5, which is a combination of toxins, infections, and nervous system dysfunction that builds up in the body over time.
How can one differentiate whether it's long COVID or whether there's another cause of chronic fatigue?
Yeah, that's a great question.
And so let me go and dive into Dr. Evan's impressive bio here. So Dr. Evan Hirsch, also known as the Energy MD, is a world-renowned fatigue expert, best-selling author, and professional speaker. He is the creator of the Energy MD method, the science-backed and clinically proven 4-step process to resolving long COVID and chronic fatigue syndrome naturally. Through his best-selling book, podcast, and international online program, he has helped thousands of people around the world resolve their fatigue. Dr. Evan has been featured on TV, podcasts, and summits. And when he's not at the office, you can find him singing musicals, dancing hip hop, learning languages, and traveling with his family. Maybe we'll get him to do a little bit of hip hop here during the interview. And welcome, Dr. Evan.
Hey, Dr. Eric. Thanks so much for having me on.
Yeah, it's a pleasure to have this conversation talking about, again, long COVID and chronic fatigue. You're an expert when it comes to this. So let's start off. I mean, pretty much everybody is familiar with COVID, but what is long COVID?
A lot of people don't realize that sometimes you can get persistent symptoms after you get a virus, basically symptoms that don't go away. So if you get a viral illness, it could have been tested positive for COVID or not. The testing isn't particularly good. And then symptoms persisted for longer than a month or two, that can now be diagnosable as long COVID or post-acute sequelae to SARS-CoV-2. And the symptoms are pretty disparate. You can have over 250 different symptoms. They can be ranging, the most common ones are fatigue and brain fog and body pain and sleep issues. Those are really the major one, but it really depends on where the infection goes in the body is going to end up determining what it ends up manifesting as. So we do know that since COVID, there's an increase in cancer, there's an increase in autoimmune disease, increase in dementia and Alzheimer's. There's increase in a number of other illnesses that a lot of people are scratching their heads about and a lot of people believe are potentially due to spike protein illness, which is the main protein that gets transmitted from the COVID virus.
Yeah, we chatted a little bit before pressing record. I mentioned during when this all started in 2020 and 2021, how we had more people with autoimmune thyroid, especially Graves' disease, come in. So yeah, you mentioned how there's an increased prevalence in autoimmunity. You mentioned cancer since all this started. So I definitely haven't seen the cancer because that's not what I focus on, but definitely I've seen the increase in autoimmune conditions. And as far as, I guess, the percentage of people who get COVID, like approximately how many people will eventually develop long COVID?
So according to the CDC, they say 20%. That means 1 out of every 5 people, 2 out of every 10. There are some studies that look at upwards of 30%, 35%. For people who were hospitalized before, hospitalized when they got acute COVID, the numbers are even higher. So what we're seeing is that really, 1 in every 3 people generally is going to get persistent symptoms, whether it's the loss of smell or taste, or whether it is fatigue, or one of these other symptoms that I previously mentioned.
And do you know why some people develop long COVID and others don't? Because I got hit hard with COVID. 2022 is when I got COVID pneumonia, and it was pretty bad for maybe like 3 weeks. And I thought maybe my symptoms would persist, and thankfully they didn't. But yeah, like why? Again, well, everybody's different, I guess, is the answer. But why didn't I develop long COVID yet other people might develop it?
Well, fortunately, your immune system was functioning well and you had a very strong reaction. In fact, the research supports that the weaker the reaction you have, the more mild you have, and the more symptoms you have, the more mild symptoms you have. The research actually shows that 5 mild symptoms give you a greater chance of getting long COVID than, kind of like what you had, which were really intense symptoms, kind of like the worst flu of your life. Sometimes the immune system can get rid of the virus, but if it can't, and the virus comes into the body and it kind of sneaks around the immune system, that's when it really takes hold and you get like some of those persistent symptoms. But what's underlying those people who end up getting it, what it looks like is that they have what I call are the toxic 5, which is a combination of toxins, infections, and nervous system dysfunction that builds up in the body over time. So it's a combination of heavy metals, chemicals, molds, infections, and nervous system dysfunction that you basically get from the moment that you come out of the womb. There's research to show that over 300 different chemicals are found in babies' cord blood. So, moms are dumping all their good stuff and their not so good stuff into the babies. Then you grow up and you have exposure to a number of different chemicals or toxins, pesticides and herbicides in non-organic food. You get mercury fillings. You live in places that have some water damage. Over half of the buildings in the world have water damage, and most of those have molds. You have exposure to people who are smoking. You get some cadmium exposure that way. So kind of these toxins build up over time. They disrupt the nervous system and the immune system. And then all of a sudden, infections can come into the body, and the immune system's off in left field, and the infection can take hold, or it can stimulate other infections to come out, and they can be more opportunistic. So that's kind of what the big picture looks like. Why some people get it and other people don't is really just based on, is the stage set? Because a lot of people think, I was fine until I got that viral illness or until I got COVID. And that's true. Well, that might have been the straw that broke the camel's back, but the stage was set already with the other toxic 5, and it just took something really stressful in order to kind of put you over.
Are there some genetics behind it as well? Because I know, like, for example, with molds, some people, have more of a challenge clearing out mycotoxins from their tissues, and we're obviously all exposed to heavy metals and all these other toxins and toxicants. So that's also, again, the good news is it's not just genetics, but I assume that's at least a piece of the puzzle.
Absolutely. Yeah. Genetics are always a piece of the puzzle. They're generally about 10 to 20% of any diagnosis that somebody has. But it is a small part, and it's not something that I talk a lot about because I used to go down the genetics rabbit hole, spent a lot of time, energy, and money working on that. And it just didn't move the needle the way that focusing on the toxic 5 has really done so for my community of people with long COVID and chronic fatigue.
Yeah, I agree. I'm with you as well. Just, because you can't change the genetics. You could, of course, do other things like adjust the toxic 5 that helps to modify the expression of the genes. And so it makes sense that you would focus on those factors. And from what I understand, you don't do any testing. Just from your experience over the years, you just really assume that everybody has, or at least your clientele, like those who come in with long COVID, have, as I mentioned, we all get exposed to toxins, but I guess the nervous system dysregulation, would you say that's something that everybody with just COVID experiences itself, or is that something that's more specific to not only long COVID, but these other chronic health conditions as well?
Yeah, so in terms of, I'll take the first part of it first. So in terms of the testing, so having done this for about a decade, I found that when I did do testing about every 3 months and I was measuring heavy metals and chemicals and molds and infections, all of them ended up coming out over the course of 12 months. So some of this is because The testing, if you do it initially, urine test, and you don't see anything, it doesn't necessarily mean that you don't have the toxins in your body. The test is really a test of excretion. And so the urine test is showing us how much you're able to excrete. So you may not be able to notice anything at month 3, but then if you repeat it at month 6 or month 9, all of a sudden you're opening up these pathways as we go through our process, and then toxins are able to then flow out of the body, and you're seeing a lot more excretion. So that's one thing that I was seeing. And so I was fooled initially when I would do a test and somebody wouldn't show up with mycotoxins. And then I do a test, 6 months later, and then all of a sudden they got a whole bunch of mycotoxins. And the question was, what is actually happening here? So that's the first thing, is that it's a test of excretion. The other thing is that these toxins are all really bound up to each other. I call it a toxic matrix, where the heavy metals, chemicals, molds, and infections are bound. And when you start to remove one of those things, like heavy metals, all of a sudden the rest of them also get released. So we want to make sure that as we're going through this process, that all of those are being covered. And what I found after doing this, like I said, for almost a decade, is that I was going at the most successful cases that I had were people where I was addressing all of the toxic 4 at that time. I wasn't doing nervous system retraining back a decade ago. And that as I was removing those things, people were getting better. So even people where I was like, it definitely seems very suspicious that you have mold, but I'm not seeing any urine. We're going to address it anyway. And sure enough, it would come out later. And I'm glad that we addressed it so that we could save them time, energy, and money. And so, about a year ago, I decided, what? I've learned all this information. I'm seeing this time and time again. It doesn't make sense wasting people's money on this testing. I'm going to go ahead and treat these. And we're having really great success doing that. And we're leaving no stone unturned, which is kind of the biggest thing when people come to see me. When they finally find me, they've seen a dozen different providers. They've been to long COVID clinics and Stanford and the Mayo and all this sort of stuff. And I tell them, I want to make sure that we're going to be as successful as possible, and we're going to leave no stone unturned, and we're going to address all of the potential causes that you have. It's not going to cost you any more money. It's going to save time, energy, money, and you're not going to have to spend money on lab testing. So I just found that to be incredibly helpful. And then, a couple of years ago, I started learning more about the nervous system retraining, and I saw people get better faster when they did the nervous system retraining, whether it was mindset work in combination with breath work and humming and gargling and all of these other different components that put the body into the parasympathetic and allow it to heal. So about 6 months ago, we created our own nervous system program, or it's a practice schedule where it basically gives you an outline of what you should be doing during your day. It's not as in-depth as like the Gupta program or Primal Trust or DNt&x or some of these other ones, but it's basic and allows people to kind of step into it. And then they can we have a more advanced version, and then they can go into some of these other programs if they want something that's more in depth. But it allows people to get their feet in the door and kind of understand it and do all of start working on all of the toxic 5 without having to learn a separate program. But that's, I'm always looking and tweaking the program to see how to get people better and faster and less expensive. And so I'm constantly, kind of narrowing it down to what are the most important things that we address. So I think I answered both of those questions, why I don't test so much anymore. And there's a couple of things I test for in terms of like thyroid, B12, vitamin D a little bit sometimes. And then also the nervous system retraining and how that's such a big component now of the work that we do, because there's a quote, and I'm going to butcher it, but the idea is that you can't solve a problem with the same thinking that got you into the problem, right? And so, and I think Einstein said, the definition of insanity is doing the same thing over and over again and expecting a different outcome, right? So it's this idea that we have to change more than just the physical. We have to change how we're thinking, our emotions, and consequently, that means working on our nervous system.
So it sounds like you had a lot of success when it was the toxic 4, but then just incorporating that nervous system retraining that led to the toxic 5 just made it even more effective.
Absolutely.
So there are other causes of chronic fatigue, right? So like how can one differentiate whether it's long COVID or whether there's another cause of chronic fatigue, or does it not really matter as long as you address the toxic 5?
Yeah, it's more of the latter where it doesn't really matter. But in terms of, figuring out if somebody has long COVID, if they got any of the symptoms that I've mentioned, chronic fatigue, brain fog, body pain, sleep issues, or any other weird symptom, neuropathy, numbness and tingling, loss of smell and taste, since 2020, and potentially after a viral illness, whether they tested positive for COVID or not, they have to consider it. And, and part of our process, since people who, like before long COVID, there was chronic fatigue syndrome, and that generally a lot of people thought, or I should say a large percentage of people ended up having a viral illness that triggered that as well. Whether it was Epstein-Barr or HHV6 or cytomegalovirus, these are all different viruses that can create a mononucleosis type of picture where you're tired all the time. And so the process that we go through is pretty much the same: getting rid of the toxic 5, getting rid of microclots and hypercoagulation, decreasing EMFs, supporting deficiencies, and working on lifestyle habits, and then the nervous system retraining. All of those are going to be important to do, whether or not somebody has long COVID or whether or not they have chronic fatigue syndrome. And, by definition, if you have the fatigue with post-exertional malaise, which basically means that you exert yourself and you feel worse. If you have the body pain, you have brain fog, and you have sleep issues, and you've had it for longer than 6 months, that's diagnostic for chronic fatigue syndrome or encephalomyelitis, which is what they call it across the pond in Europe and beyond, where basically they're the same thing. But so essentially, long COVID is chronic fatigue syndrome, but the trigger is the spike protein. And that does change a little bit about what we do with the protocol, but it's really not much.
Okay, makes sense. So you mentioned the herpes family of viruses before: Epstein-Barr, cytomegalovirus, HHV6. So once you have those, from what I understand, you don't get, you're pretty much living in harmony with like Epstein-Barr and HHV6. Is it similar with long COVID? Is it something where you're trying to actually get rid of it completely, or is it where you're just trying to live in harmony with it?
Yeah, that's a great question. For any of these infections that we're looking at, in general, in this form as humans, we're 90% bug cell and 10% human cells, right? So it really is this complement and this relationship that we have that has been disrupted. When you have the heavy metals, the chemicals, the molds, the nervous system dysfunction, all of those things are going to hijack the immune system and allow infections to become opportunistic. You get antibiotics and it disrupts your flora, and then all of a sudden you've got a whole bunch of fungus. You get mold exposure, and then you got a whole bunch of fungus. When it comes to the infections, we're talking about viruses, bacteria, yeast, spirochetes like Lyme disease, and then also parasites. And so all of those end up contributing to the chronic fatigue syndrome, and we really want to recreate the balance. So we try to get rid of them as much as possible, but 100% getting rid of them is not really necessary. It's more about, when people get their energy back and they've got 8, 9, 10 out of 10 energy, they don't really care whether or not there's still some infection left. It's more about, creating that balance. That's always the goal. And oftentimes, it's more about getting the immune system back online so that it can bring those infections back into balance, and that comes from addressing the heavy metals, the chemicals, the molds, and the nervous system dysfunction. So that's always very interesting, because I get so many people who come to see me now who've done different spike protein protocols, FLCCC, and a lot of those, people can get better, but oftentimes it requires, if they're not getting better from going directly at the spike protein, it's because they have all these other causes that need to be addressed in order for them to free up the immune system to kind of bring everything back into balance.
Yeah, so I was diagnosed with chronic Lyme, Bartonella, and I'm pretty sure you were too. So but in 2018, when I got tested, and I was symptomatic. I wasn't really symptomatic, but I wasn't it wasn't like debilitating fatigue or really severe pain, but I had more neurological symptoms, enough where I did things to address the Lyme and Bartonella. And then I retested 6 months later, and there was really no change, but I felt great. And it was like one of those things like, do I really want to just keep on retesting it? Because it's like, again, I've had other like I've had Lyme experts on, and they say, really, you're not, since it's intracellular, you're probably not going to get rid of Lyme and Bartonella. So do you really want to, I mean, like you said, you want to try to reduce your infection burden as much as you can, but still you're always going to have microbes, and as long as you're doing things to optimize your immune system. So it sounds like you kind of agree. Again, I don't know if you ever retested yourself also when it comes to like the Lyme and Bartonella. That sounds like you know.
No, yeah, I mean, my story was very similar. I had chronic fatigue syndrome for 5 years, and it just about destroyed my life and my relationships and my business and all that sort of stuff. And I finally had to go on a journey after napping underneath my desk for, thousands of days. I finally had to go on a journey of figuring out what the causes were and then address them in myself, wrote a book about it, and now it's become my mission in life. But I absolutely agree. I talk quite a bit about how testing is highly imperfect. And so if you're looking at a serology test, which is a test looking at the immune system's reaction to something, this is like the IgG or the IgM blood test, probably like what you got. That test is dependent on an intact immune system. If you have heavy metals, chemicals, molds, other infections, nervous system dysfunction, immune system is not going to be accurate. It's not going to be functional. And consequently, then you're asking a dysfunctional immune system to give you an accurate read on a blood test. It's just not going to happen. You're just not going to get good data. And then when we're looking at other testing in terms of the urine tests for heavy metals, chemicals, and molds, like I mentioned before, those are really more tests of excretion. And the more toxins you have in your body, the more clogged those detox pathways are and the less you can excrete. And so consequently, when you are excreting, that is a better sign. And that's not really a test of your total body burden. It's more of just a test of excretion. The last thing I'll say on it is that sometimes people will say, well, what about PCR testing, which is a DNA test looking at the DNA of an infection? Well, if you're looking in the urine, if the infection does not live in the urinary tract, you're not going to see it. If you're looking at it in the blood and it doesn't live in the blood, you're not going to see it. And oftentimes these are intracellular, they're in the muscles. If you wanted to see if Bartonella is causing your muscle pain or your fibromyalgia or your plantar fasciitis or your Morton's neuroma or your calf pain or calf muscle cramps, you'd have to do a biopsy of your muscle, which is incredibly painful, and nobody's going to do that for you. And so consequently, if you're not looking in the right place, the testing is going to be imperfect, which is one of those reasons why I'm just going to hedge my bets. We're going to address all of these things and make sure we leave no stone unturned. Yeah,
I mean, it's important to have this conversation just because, like in the case of Lyme, a lot of people will do Lyme testing and they'll just do like a Western blot, for example, and it comes back negative. And then their doctor says, oh, you don't have Lyme. But I mean, it definitely could be false negative. There are other strains of Lyme, not just Borrelia burgdorferi, but others that aren't tested at standard labs. And then, Bartonella often gets overlooked. Like when you go to a regular doctor, if they are willing to test for Lyme, usually they're not bringing up Bartonella, Babesia, all these other co-infections. And then, even like the stool testing, which I admit I still do some stool testing on patients, but you mentioned like the GI map, which is a DNA-based test, but even that's not perfect. I get a lot of people that show up negative for parasites. And again, maybe many of those people don't have parasites, but I think it's safe to say that some people who have parasites will have false negatives on not only I'm not just picking on the GI map, but pretty much all these other stool tests as well.
Yeah, I absolutely agree. I mean, we now know that parasites can digest themselves outside the body. I've had people come into my office when I had a brick and mortar and they would say, hey, look at this parasite that I found in my stool. And it sure looks like a parasite. And we send it off to the lab and the lab says, why did you send me an empty container? And we did that probably about a dozen times before we said, okay, we're not going to send it off to the lab because they're just going to give us this report, And so I never realized that until I heard somebody speak about it and they said that they could digest themselves. And I just thought that was fascinating. And one of the things that I do want to touch on also is that, people may think that it's kind of irresponsible to address all these things at the same time. They may think that I'm using antibiotics, but everything that I do now is natural. I'm 100% online. It's all herbal. And consequently, when we're using these herbs, we're able to do double and triple and quadruple duty, where I'm able to use a couple of herbs that end up addressing all of those different infections, for an example, so it's not like we're going after things with antibiotics where it's going to have a lot of negative side effects.
If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and/or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter. Yeah, I'm the same way. I don't have prescribing rights. And I know since you're acting more as a health coach, you're a medical doctor, but still the way you practice, you're also relying on the herbs. But the herbs are very powerful and could be very effective and don't have the same side effects, more importantly, as the antibiotics. So yeah, that's great that you're taking more of a natural approach when it comes to these infections. What are your thoughts on, there's other, besides like herbs, do you really just take, I know you do more than herbs because you do the nervous system retraining and all that, but then there's also things like ozone therapy, like IV ozone and hyperbaric oxygen when it comes to infections, and like frequency therapy. Do you incorporate any of those, or is it really just you focus on what you do and you've had a lot of success in what you do, so you just stick with your treatment options?
Yeah, it's the latter. I'm always looking for other things that we can implement. And with ozone therapy, I used to do that when I had my brick and mortar. We did MAH, Mater Auto Chemotherapy. And that was basically, you take the blood out of the person, you mix it with ozone, you put it back in. And ozone is definitely a big antimicrobial. It's pro-oxidant. It can kill a lot of infections. It can boost mitochondria by 400%. But what I saw, and I see that with ozone therapy, and not so much hyperbaric oxygen, but IV vitamin C and some other natural antimicrobials that are IV, is that they are indiscriminate. They're killing a lot, and they cause a ton of die-off. And consequently, it makes the person worse, and sometimes for months. And it's really hard for them to recover. And so when I saw that in my brick and mortar, I immediately got rid of that therapy because it was more than I was willing to handle when I saw some people end up starting to have mental health issues from killing off some of these infections like Babesia and Bartonella that can cause anxiety and depression, and you kill them, and then you end up having die-off, which can cause some of those symptoms. And so it wasn't something that, and in terms of managing die-off, or a Herxheimer reaction, which is what happens when you start killing some of these infections, the body really likes small changes. We use tinctures now, so we're increasing by a drop. When somebody feels worse, we're able to navigate it, we're able to pivot, we're able to give them more die-off support, and then they can continue to move forward. And it's so much more graceful than utilizing a sledgehammer like an IV. So that's some of my concerns. I actually just saw somebody recently who had done EBOO therapy, EBOO, which is kind of a combination of sauna and ozone therapy and something else. And it was just very intense, and it set her back months. So for some people, these therapies can be good, and for some of them, not so much. With hyperbarics, I find that the oxygen is not enough to necessarily kill infections. If it is going to kill something, it's kind of like a small layer that's usually not that significant for folks, but it can boost mitochondrial function. But you can also get just as much support from taking the right mitochondrial supplement. So that's ozone and hyperbarics and IV vitamin C. In terms of frequency therapy, I do like the idea of this. I've had a couple of people use it peripherally. I'm familiar with some of the practices of practitioners, but I just haven't seen a lot of success with it. And I think that some of it also comes from being focused on one thing. So like I mentioned before, you cannot get rid of infections if you have heavy metals, chemicals, molds, and nervous system dysfunction. You just can't. And so if you're doing frequency therapy for a particular infection like Lyme, and you haven't addressed all these other things, you're not going to be successful. So it's very possible that frequency therapy could be successful if you've addressed these other things as well, or if the frequency therapy can address these things and addresses them in the right order, then potentially it could work, but I just don't know enough about it.
Yeah, wouldn't that be the case also with IV ozone and hyperbaric oxygen, that you would also still want to address the toxins and toxicants first?
Exactly, yeah. So it's whenever people come to see me or we get on a free call and we want to see if we're a good fit to work together, I'm always looking for what's missing. And I've never met anybody who's addressed all of their toxic 5 completely and hasn't gotten better. So they're always missing something from oftentimes one of these treatments. Ozone therapy and HBOT are not going to address your heavy metals, your chemicals, and your molds. So absolutely, that is definitely something people have to keep in mind.
What approach do you take when someone's sensitive to supplements? So like the herbs, a lot of people, like if someone has like mast cell activation syndrome, for example, and they're just really sensitive, do you just microdose, or do you do the nervous system retraining initially? Or
Yeah, exactly. That's exactly right. So oftentimes I'm at the point where people come to talk to me, and if they're really sensitive to supplements, I say, if they haven't done a nervous system retraining program yet, I say, go do a nervous system retraining program for 6 months and then come back. And if you're not all the way better, then, we can get rid of the rest of the causes that you have. So what I used to do, so the nervous system retraining really is the absolute best thing, I think, for MCAS. I've seen it work so many different times, and I've just been amazed by it time and time again. There's just like something that clicks when people are committed, they're doing the nervous system retraining in earnest, and potentially other things that are kind of moving them more into their parasympathetic. What we do for folks who then, if they are more sensitive, or if they can't get all the way with the nervous system retraining, but they're still sensitive, oftentimes I like to use things that are going to bypass the gut. 80% of our immune system is in the gut. And so oftentimes anything that you put down there, whether it's food or supplements, people can react to who have MCAS or are more sensitive. And so I really like the tinctures for this, where we're doing drops on the hands, they can rub them in, and you're getting about 20% of a dose, which is really just perfect for somebody who is more sensitive. Oftentimes we're also pivoting away. We've got a 4-step process that we take people through, where step 2 is replacing deficiencies in vitamins and minerals and lifestyle habits. And step 3 is opening up drainage pathways. And step 4 is removing the toxic 5. Oftentimes we'll skip step 2, go directly to step 3 to try to open up these pathways. And then in order to be able to get them to remove, you just have to remove like a layer of toxin for folks in order for them to decrease their sensitivities. Oftentimes people who are more sensitive, they can only eat a couple of foods. But when you start to remove the toxins, all of a sudden the immune system is less reactive, and they can open up their palate and they can start consuming more foods, taking more supplements, etc. But I would say the nervous system retraining really is the biggest bang for the buck. And they're not that expensive, and it's really great for folks who are more sensitive.
can you expand a little bit on opening the pathways? Do you mean like supporting lymphatics? Can you talk a little bit more about that?
Absolutely. So when we look at all the ways that we get toxins out of the body, we're looking at what I call the exit pathways or drainage pathways. People sometimes call them, or detox pathways. And we're looking at the liver, a couple of phases in the liver, the kidney, the lymph, which is the garbage system of the body, the glymphatic system, or the neural lymph, which is the garbage system of the brain, gallbladder and the biliary tree, and then the intestines. So all of those pathways essentially have to be open in order for you to get toxins out. And just by opening them, oftentimes you can start to release some of the toxins. If you remember what I said previously, I was talking about how the more toxic you are, the more clogged these pathways are. And oftentimes that's when you're not showing up with excreting things in the urine. And so you really have to open up these pathways in order to be able to then be successful at removing the toxic 5 out of your body. And so generally, when I give people an image of this, I talk about a funnel where, essentially the bottom of this funnel is the drainage pathways or these exit pathways. And if you're dumping toxins, you're pulling heavy metals out of the tissues, you're putting them into the lymph system. If it's clogged, it's just going to go right back into a different compartment. So we do want to make sure that bottom of the funnel is patent. It's opened so that you can get the toxins out. And so in step 3, we're opening them up a little bit just to kind of prep the body. But then there is this dance that ends up happening, this pivot that ends up happening when you're in step 4, because everybody detoxes at a different rate. So we want to find the rate at which a particular individual detoxes. And we want to detox at a rate that they can tolerate. So essentially, we wanted this to be more of a drip system than a flood. So we can pivot back and forth between step 3 and step 4 so that we can keep opening up the bottom, these exit pathways so that there's more of a flow. Ideally, there's a nice flow that's working its way through. If you fill up those pathways, you end up feeling worse, you end up having die-off, you have to stop, you have to decrease your dose a little bit, pivot to step 3, increase some die-off support, and then pivot back to step 4 and keep moving forward. And so I tell people this is really a process of 3 steps forward, 1 step back, where you just have to recognize that so much of this process is pivoting. And that's one way that we personalize this whole process for people.
All right, awesome. I definitely want to talk about your 4-step energy MD method. But before that, when you were talking about long COVID, you mentioned helping people with microclots. Do you use things like proteolytic enzymes like nanokinase, or is it more advanced as far as breaking up those microclots?
No, that's definitely what we're using. Natokinase and serapeptase and bromelain. Depending on the person and where they are in the world, we can get them different products. But yeah, the microclots, for those who don't understand, we used to call this hypercoagulation before COVID came around. But it's essentially the fact that, having the toxic 5, especially the infections, ends up increase the clotting in the body and decreases the flow of oxygen to the tissues. And consequently, then you're also decreasing the flow of the waste products out of the tissues. And so when you have these microclots, you end up with a lot of symptoms depending on where the clotting is happening. And it's interesting. I was actually just listening to sports commentary before I go to bed. It kind of changes my brain. And I was listening, and there was a basketball player who was just coming back from having some clots in their legs. And I was curious whether or not they had the spike protein, or whether or not there was something that triggered it besides what generally would have that from a more conventional standpoint. And so, yeah, with the microclots, we definitely want to decrease the amount of clotting that's happening. And then we also want to digest the clots. And that will end up increasing the blood flow and increasing the oxygenation to the tissues. And there are some therapies. There's one called apheresis, which is mainly being done in Europe, where it's kind of like dialysis, where they're pulling the blood out of the human, they're running it through a filter, they're getting all the clots and then putting the blood back in, and people are reporting significant improvement. It doesn't seem like it's lasting, but they are noticing significant improvement when they go through that process initially. And a lot of that has to do with getting rid of the microclots out of the body.
Very interesting. All right, so let's talk about that 4-step energy MD method to help with chronic fatigue and long COVID.
Yeah, so the first step is figuring out what causes an individual has. And so with somebody who has long COVID or chronic fatigue syndrome, we're always going to be addressing the toxic 5. We're going to be addressing microclots and hypercoagulation. We're going to be addressing adrenals and mitochondrial function. But I'm not always sure whether or not we're going to be addressing thyroid or sex hormones or B12 deficiency or different lifestyle habits, depending on the individual. So this is the first way that we personalize our program, is we create a personalized program for people based on the causes that they have. And there's over 30 that we're looking at. When we're looking at deficiencies, these are things that are not in the body that are supposed to be, and toxicities. These are things that are in the body that aren't supposed to be. And a lot of people, have spent a lot of time, energy, and money working on the deficiencies. They've optimized their hormones, their adrenals, their mitochondria, their vitamins, their minerals, their lifestyle habits, and they've done a great job of that, but then they plateau and they still are not feeling optimal. And that's because these deficiencies are actually caused, 80% of them are caused by the toxic five, by these toxicities. And so we still want to, in step 2, we start by replacing the deficiencies, and because we do want to optimize them, because it does make the person more resilient, and it decreases inflammation. It recreates their circadian rhythm, so their sleep is better. It gives them a little bit of an uptick in energy in about 50% of the people that we see. But the magic really happens, step 3, magic really happens in step 4. And that's what this process is all about. It's preparing the body for removing the toxic 5. And you can be doing the nervous system retraining while you're going through this. So it's the other toxic 4 that we're talking about. And so we're replacing the deficiencies in step 2. And part of that too is that when we start to remove the toxins in step 4, it can be stressful on the body. So having the adrenals and the mitochondria and the thyroid, et cetera, optimized, that ends up allowing you to deal better with stress and function better as you're going through the process. Then step 3 is opening up the drainage pathways that we talked about, liver, kidney, lymph, et cetera. And then step 4 is removing the toxic 5. And I really like to do it in the order of heavy metals, chemicals, molds, because of what we talked about previously, where you really can't get rid of the infections if you're still having the heavy metals, chemicals, and molds present. That's the 4-step process that we take people through. The 2 major tests that I require people to get as part of the program is a test to determine whether or not they're living in molds, because if they're living in mold, it's very hard to get better. And the other one is whether or not they have any hidden infections in their mouth, because it's very hard to get people better if they do. And that generally comes from, even any sort of tooth extraction, whether it's a wisdom tooth or otherwise. It can be a root canal, it can be any sort of history of having an abscess in the mouth. Those are kind of the main potential causes that would indicate that people have hidden infections in the mouth. And then they're just leaching all that inflammation and toxin, and infection is just dripping into the rest of the body, causing inflammation, just doesn't allow you to get better. So I gave you more than what you asked for, but I talked about the 4-step process, and then also wanted to talk about those 2 major tests that I think are most important.
What the infection you recommend, like for them to get a cone beam?
Exactly, yep. So the dental test is going to be the cone beam CT. And you do want to make sure that it's done by a biologic dentist and that it's read correctly by somebody who knows how to read these cone beam CTs. And then the testing for the mold, I prefer the EMA test by Real-Time Laboratories, because it's a combination. It's an environmental moldiness and mold assay. And it's a combination of looking at mold spores as well as mycotoxins. So really important to make sure that you're looking at both of those in order to, because sometimes mycotoxins aren't present, but mold spores are.
So you're not talking about urinary mycotoxins, you're talking about actually testing the home for the mold spores and mycotoxins?
Correct. Yep, testing the home. Yeah, it's a swab test. So you're just kind of cleaning at different places in the house to getting a dust sample about the size of a cotton ball.
I'm familiar with Real-Time Labs. I didn't know they had testing I know they have urinary mycotoxins testing. I didn't know they tested for the home. Is that an ERMI type test or?
Well, the ERMI is a mycotoxin side of things. And so it's called an EMMA, E-M-M-A.
Okay.
And for those interested, they can go to energymdmethod.com/EMMA, and it'll take them to our online store, and they can order that. It's about $350. Definitely worth it. All tests are imperfect, as I've mentioned, including any sort of mold testing of the house, but this is the best one that I found.
All right, awesome. Well, before we wrap things up, anything else that I should have asked you that I didn't ask you? Anything else you'd like to discuss? If not, how do people know if you can help them with their long COVID and or chronic fatigue syndrome?
One thing that we didn't talk a lot about was, with nervous system dysfunction, it's essentially caused by any sort of stressor that you've had in your life, whether mental, emotional, or physical. So we've been talking about the other toxic 4, the heavy metals, chemicals, molds, infections. Those are all physical. But the mental and emotional ones are traumas, whether it's big T trauma, like having some sort of significant abuse, or whether it's considered little T trauma or more mild, like I had, which is, my parents were were loving and this, that, and the other thing, but I still was trying to navigate getting my needs met from these imperfect adults. And then I had siblings who were also imperfect and they were trying to get their needs met. And then I was at school and I was rejected by peer groups from these kids who were all trying to get their needs met. And then I, had relationships and breakups and college and medical school and residency and all these, mental and emotional stressors that eventually, led in part to the toxins that I ended up accumulating in my body that ended up causing my chronic fatigue syndrome. So I think it's just always important to note that anything that changes the way that you look at the world, and if you start to see the world as a more negative place, when you go through that transformation, you're really happy-go-lucky as a kid, and then that shift ends up happening. Oftentimes, that can be part of the reason why people end up with chronic fatigue syndrome or also with long COVID. So I would say that's part of it. Another component of that is the mindset work. And we have a 4-step mindset practice that I think is really important. Focus on gratitude and envisioning your ideal day and asking yourself empowering questions and looking at any sort of negative beliefs that you have and flipping them into empowering beliefs. So that all goes along with like the nervous system retraining. And then, the way that I know I can help people is I get on these free calls with people after they watch my masterclass, and this is all on my website. And I'm always looking for, have you addressed the toxic 5? If you haven't, and then you're also have the characteristics that we're looking for success, that's when I feel like we're a good fit to work together. And I tell people that's the case. About a third of the people that I get on a call with, I tell them that I don't think that we're a good fit to work together, whether for one reason or another. But I try to be really honest with people because I only want people joining my program who are going to be successful. So if people are interested, the best place to find me is at energymdmethod.com. And on there, you'll be able to learn all about the work that we do. And you can watch my latest masterclass. It's 40 minutes. If you watch it on normal speed, it's 20 minutes if you watch it on 2 times speed. And then you can get on a free call with me and see if we're a good fit to work together. But yeah, thanks for having me on. I appreciate it.
Yeah. And then also your podcast, make sure that they check out your podcast, your book, Fix Your Fatigue. And I assume, can they find you on social media as well?
Yes, I am in all those places. It just depends on, where they are in the process of learning and educating. But if they want to get to the goal fastest, it's getting on a call with me and seeing if we're a good fit to work together.
All right, awesome. We'll make sure to put those links in the show notes. And this was a wonderful conversation. Thank you so much, Dr. Evan. Appreciate you. You shared so much valuable information. I learned some things as well, and I'm sure my listeners did.
Thanks so much for having me on, Eric.